Type in your box. Let me know you can hear me. And let me get Dr. Bergman unmuted. Unmute Dr. Bergman. Hi, Dr. Bergman.
Hi.
I apologize. I never have technical difficulties anymore except with you. All
And
my fault. Hi, happy Thursday.
happy Thursday, except it's Friday. But yeah.
Oh, that's right. It is. This is going to be a fun show. Oh my goodness. Well, we've got people from all over. We've got people in Canada, Mexico, all over the United States. They're already typing in their questions. They're super excited. So we're going to go ahead and get this puppy started. So this is a
Cool.
conversation with Dr. Bergman. There is handsome Dr. Bergman. And I am excited because next Friday I am flying on a plane to Florida because Saturday I'm going to be docking on the ship with Dr. Bergman for a week of fun and education.
Cool.
How cool is that? So I'll get the backstory, guys, and we'll find ways to stump him. We're going to play some games today, too. So welcome to Gluten, Dairy, Sugar Free. I'm Michelle DeBerge. I am your host. This is Dr. Bergman. I'm going through this a little fast because you've sort of met us. So we're going to ask him all kinds of questions. Today's topic is arthritis. Diana wrote, too funny. You guys are going to have fun. We are. Today's topic is arthritis. We're going to do it a little different today. Today, we're going to do a lot of the medical stuff in the beginning, and then we're going to get into foodie stuff. And along the way, we're going to play Stump the Doctor and True and False. So get those questions ready. I know you guys have been practicing all week. Dr. Bergman, what you don't know is people have been calling me, typing me, and sending me letters asking questions for you.
Cool.
Yeah, they're excited. So I found out there are over 100 types of arthritis. Can you tell me a little bit more?
Yeah, I know. It's
That looks official, right?
it yeah, it sounds official because what's neat is, and this is where diagnoses comes in. You get a bunch of different symptoms, and a collection of symptoms is going to be a diagnosis. And then this goes into the standards of care. So if you have psoriatic arthritis as opposed to rheumatoid arthritis, as opposed to degenerative joint disease, once you have that diagnosis labeled on the patient, then you have certain protocols that you can follow, which are in the standards of care. And it's all to protect yourself legally if you're a doctor, because if you give somebody, say, Tylenol for degenerative joint disease and they develop liver damage and die, because Tylenol is the deadliest drug in America, you're not liable because you followed the standards of care and you did exactly what should be done, okay, in that. So it's completely ridiculous. You got to take those 100 diagnoses, throw them out, and the number one thing is take apart the word arthritis. Arth means joint, itis means inflammation. So you're just saying in Latin inflammation of the joints, and that's not true. The most common type of arthritis is degenerative disc disease. It's also called degenerative joint disease. It's also called osteoarthritis, and it's adaptive. It's actually the body trying to protect an unstable segment.
Oh.
So we throw those different types of diagnoses away and look at the intelligent responses to the body. And I know this is different because when you're talking about rheumatoid arthritis where the body is actually attacking itself, or psoriatic arthritis where the body is attacking itself, and then there's also skin lesions. When you're looking at that, you're going to think, well, no, the body is not acting intelligently. It's recognizing self as a problem or a pathogen. And in actual fact, the therapies, if you're going to do therapies to try and correct an autoimmune condition, you're completely missing the boat and the patient's never going to get better.
Wow.
You got to approach the body that it is intelligent, everything it does is intelligent, and then figure out why the body is doing that, and then you can correct and reverse arthritis.
So what you guys don't know is Dr. Bergman's in Southern California. I'm in Northern California. We're partnering up together on these informational calls to help you, educate you, give you answers to your question, and then help you with your food issues. But I make the slideshows. Yeah, I go listen to his lectures, and I make the slideshows, and I ask him questions. So some of my slides that I pick up that are the medical things that are on the web are what we would all find when we're looking for answers. And it's so great to watch him tear it down and show us what's wrong. So the next couple of slides you're going to see are ones that have told me that this is the answer, and we're going to actually ask him what the truth is. So I just want you to know that's why this looks like this, okay? So the number one thing that people tell me when they have arthritis is that they have a lot of pain. And
Hmm.
it's pain, and we were saying in the joints. So the number one photo that came up when I did my research, Dr. Bergman, don't laugh, no, you can laugh, is first of all, we were looking at joints, and the everything in the research that I found, like if I put in like, why is my arthritis hurt, or why do I hurt for arthritis, this is what I'm getting. Can you explain what's really going on?
Oh my God, I love the pictures. Yeah,
Okay.
this is absolutely brilliant. Okay, because when you look at most of the joints in the body, and the joint on the left is the normal joint, you can see two bones coming together. The bones are covered in a cartilage, and this is like a cushion, almost like a Teflon coating. But you look at the synovial fluid, is because surrounding that joint.
That's the teal
If you
stuff in
think,
the picture, so you guys know that's the teal.
yeah, it's listed as synovial fluid. That synovial fluid is a superfiltrate of blood. And when you look at this, what a lot of healthcare professionals, boy, am I saying that tongue in cheek, what they'll say is that when you look at the bone on the top and the bone on the bottom, if that's, say, the knee joint, where this bone is pushing down on it, there's a tremendous amount of force on that joint. So what the body is designed, that cartilage or that thin layer on the outside of the bone, doesn't have a good blood supply.
Mm.
And that's what a lot of medical professionals will say. They'll say, well, it doesn't have a good blood supply, so it can't regenerate. Well, that is
Wow.
completely ridiculous, because if you look at this, it's designed to get its nutrients through synovial fluid,
Ah.
because it's under such compressive force loads that blood vessels would be crushed. So that would be a piss poor design. We wouldn't be able to walk or stand or put joints under pressure if the cartilage had an intricate system of blood vessels. So cartilage and meniscus, they usually have blood supply on the outside where it's not under compressive force loads, but on the inside, the joint gets its nutrients from synovial fluid. Now here, this is totally cool. When you look at that joint on the left-hand side, you're going to see the synovial fluid, that beautiful teal color. That's a superfiltrate of blood. So now, if the blood isn't healthy, like let's say you're eating a lot of polyunsaturated fats, that's going to clump blood cells together. If you're diabetic, that's going to cause the blood to be thick. And so those different types of conditions are going to limit synovial fluid production. So then you get the bone, you get that beginning osteoarthritic formation, or that middle picture, that the joints tend to not have the nutrients. The cartilage tends to deteriorate. So you get the hard bone coming down on top of the hard bone, and it begins to wear out.
Mm.
That's not exactly what's happening, but that's, let's just leave that for a minute. But when we look over at the other picture on the left, the normal joint, see that little thing on the left that says bursa?
Yeah.
And then you've got the muscle, and then you've got the tendon all on the left-hand side.
Mm-hmm.
Well, that's actually not exactly correct, because
Oh.
the bursa sac should surround the tendon or go underneath the tendon as well. Now, the
Oh.
bursa sac is a cushion, and it's a cushion filled with bursa fluid. Duh. Okay, so the synovial membrane, okay, or the surrounding the joint, is filled with synovial fluid. Well, the bursa fluid is a superfiltrate of blood as well. The synovial fluid is a superfiltrate of blood. So without healthy blood, and this is without healthy nutrients, you're not going to have healthy joints. Now, this is where ignorance comes in. If you have unhealthy blood, the synovial fluid inside of that joint is going to be compressed, and you're going to have the cartilage rubbing and grinding and creating friction. And that friction, just like if you rub your hands together, is going to create heat, and
Mm.
heat is going to be called inflammation.
Okay.
If you don't have enough fluid going to that bursa sac, you're going to have the tendon rubbing against the joint, and that's going to create inflammation, and that's going to cause heat. Now, ignorant but well-meaning healthcare professionals are going to apply ice to shrink the swelling of the bursa fluid, to the bursa sac, and this is where bursitis comes in.
Oh.
And they'll put ice on the synovial fluid, or on the synovial membrane, to shrink the swelling of that joint. Well, if you have, and think of this, the bursa fluid is not there because there's unhealthy blood or lack of blood flow to the joint.
And this is
And
because you're
the
eating bad food, right?
bad food or bad mechanics.
Okay.
And we're going to go over that when we hit the next picture.
Okay.
So the bursa sac doesn't have that fluid in it, so it creates the friction that creates inflammation. Ignorant doctors and physical therapists and ignorant chiropractors will put ice on it, and the ice will feel good because
Right.
it's going to shrink the swelling of the membrane. However, remember, it's from lack of healthy blood flow. If you put heat on a joint that has bursitis or has tendonitis or has a joint pain, that heat is going to rush blood, because when you put a hot pack or heat on a skin and you take that heat away, what color is the skin? It's
It's
red,
red.
right?
Yeah.
Yeah, because what you're doing is you're tricking the body. You're increasing the temperature, so the body increases blood flow to that area to equalize the temperature.
Oh,
That's
so they're doing the opposite of what they should be doing. So you should be putting heat on it, not ice.
exactly. This is where the ignorance
Oh.
of arthritis comes from. So when you put heat on it, you're going to fill up the bursa sac with fluid, you're going to fill up the synovial membrane with fluid, and you're going to correct part of the problem. Okay, by applying fluid in there. When you look at the osteoarthritis next to it, what happens is, see on the left where it says normal joint, you have that space and that cushion between one bone and the other.
Uh-huh.
What happens in osteoarthritis, that space becomes less, and
Mm.
so now the joint is unstable. So the body, in its infinite wisdom, is going to start to lay down extra bone, and this is where bone spurs come from. This is where the bone erosions
Oh.
come from.
Okay.
And so it's actually increasing the surface area where the bones connect or articulate, and that's when you look at arthritic bone changes. Now, ignorant doctors will call this bone spurs. And they'll
Ah.
go in and they'll say, oh, I cleaned up the bone spur with the surgery, the arthroscopic surgery. And in reality, they're actually destabilizing the joint.
Because the body knows best. Do you want the next slide?
Almost 1 second, because
Okay.
the rheumatoid arthritic ones,
Yeah.
that's where the body is actually recognizing the joint has a problem or is a pathogen, and now it's building antibodies to attack the joint. So the
Um,
rheumatoid arthritis, and this is like the host of it, it's going to be scleroderma, psoriatic arthritis. I mean, a host of different arthritides that you can put in the autoimmune category. And it's only if you have rheumatoid arthritis with skin lesions, it's going to be labeled one thing. Rheumatoid arthritis in this area, it's going to be labeled something else. So that's where you come up with 100 different diagnoses. When it
ah.
really is either the body's attacking the joint or the joint is adapting to a toxic deficient circumstance. And that's all arthritis. You wipe out every 100 different diagnoses. It's the body adapting to a deficient toxic circumstance.
So you guys type in your box. Did that make sense? That was brilliant. So in the beginning, overwhelmed, 100 different types, all these little body parts, and all of a sudden he said the exact same thing in the beginning and at the end. Two things that are happening. That's it. That's simple. That is so cool. But we're getting a lot of yeses. Okay, another slide here that I was thought might be interesting, because one of the things that people have been telling me is they get told they have arthritis in all different parts of their body, and so this slide made sense to me. But how about you?
Oh yeah, I like it.
Okay.
And when you look at it, you're seeing on the upper left joints of the spine, you're seeing on the lower left the knee joint, you're seeing the hip joint, the hand joints. Nobody has arthritis of the entire body, but what they will have is a toxic deficient circumstance where the body can't produce healthy synovial membranes or healthy synovial fluid, healthy bursa fluid, or there's been some type of trauma that's interrupted the blood supply and nerve supply and biomechanics to the joint. The joints, all joints in the body, every joint needs three things. It needs a healthy nerve supply. Joints have a nerve supply. You need a healthy blood supply, and you need healthy mechanics. So if you've had some kind of trauma where the pelvis has been knocked out of alignment, then you're going to see a degeneration of the lumbar. If you've had some type of pelvic or knee or foot problem, that's going to cause the knee to have a dysfunction.
So I
If you're
could
going
have
to have
arthritis in one part of my body and the rest of my body's okay.
Absolutely. Yeah, nobody has arthritis at every joint. That's told by ignorant
So
doctors.
one of the
But what
questions that just came in on this on what you're talking about right now is this what happens in fibromyalgia also?
um, Kind of. Fibromyalgia is going to be diffuse joint pain and diffuse stress, anxiety, sleep, digestive issues. I mean, it's a catch-all diagnosis for a bunch of things.
And we talked about
But
that last time, so we have a lot of information on that for Diana who just typed in. So we'll make sure to show you where that is.
oh yeah, and look at the cause of this, because when you're looking at the that hip picture on the upper right, that's red and inflamed and distorted joint. And
Hmm.
what that is the body's adapting to an unstable joint, so it's laying down extra bone. It's adapting to a toxic and deficient circumstance where it can't produce healthy synovial fluid, and responding to that deficient toxic environment, and by stabilizing the joint so the body doesn't break down further. And that's what fibromyalgia is. Fibromyalgia is response, an intelligent response to a toxic deficient circumstance.
I had another picture that I thought was interesting. I actually used to have a friend whose hands looked like this,
Mm-hmm.
and she struggled to move. And there's this is an interesting story. Where I go to get my nails done, the lady who owns the salon, her hands actually look like this, and she still does nails. What? Why is this part of the body adapting again, or is this something different?
Yeah, it is the body adapting, but what's frustrating is this is an autoimmune disorder. Now, if you look before 1940, there was almost no autoimmune disorders. It was like phenomenally rare, where the body would be malfunctioning and attacking itself. Now we're seeing a massive. It's actually the fourth most popular or common disease in America is
Wow.
autoimmune disorders, where the body is attacking itself. And the reason is from the foreign proteins that we're getting in our diet that have never been in our diet before, like the
Mm.
hybridized wheat that was developed in the 70s, the genetically modified stuff in the 90s, the massive influx of vaccinations are all putting foreign proteins that we've never seen in our 40,000 years of existence. Okay, has a human body, which actually might not be 40,000, it may be over 100,000.
Wow.
But just know that the body's been here for a long time, and all of a sudden in the last 30, 40 years, we're getting proteins that we've never recognized.
So we're sort of
Now,
turning into mutants in a way by eating all that stuff.
oh, it absolutely. It's triggering a host of natural body defenses.
Wow. Isn't
Because
that crazy?
if you get a foreign protein that your body doesn't recognize in a different area, the body instantly thinks that's going to be a virus, bacteria, or fungus. So it's going to produce an immune system response and attack that area.
So,
So yeah,
oh, sorry. Go ahead.
and that well, that's what rheumatoid. That's what you're looking at with this hand distortion, is
Oh.
the body is actually acting correctly to attack the joints. Now, this is late stage. When it
Hmm.
first is there, the way it's diagnosed is there's heat around the joint, there's swelling around the joint, and so then it's considered rheumatoid arthritis if it's affecting these joints, if it's affecting those joints. We're talking about the far end of the finger, the close end of the finger. So there's actually this is where you get those diagnoses. What's foolish is what they do. When you first get that inflammatory response where the joints are inflaming, what they'll treat it with steroids. They'll treat it with anti-inflammatories, which weaken the immune system response. They'll treat it with all of these different chemicals to try and second guess the intelligence of the immune system, instead of realizing that there's some massive foreign proteins in the system
Oh
that
my
the
goodness.
body is attacking. So the way to correct rheumatoid arthritis is not to attack or look at the joints as pathology, but clean up the blood, get rid of the foreign proteins, find out what's causing the immune system response, and then realign and regenerate the joints. But it's a blood and immune system issue, not a joint issue. The joint is downstream. The joint is just how it's presenting. It's not even close to the problem.
Because it's battling inside. We've got a question or a comment that came in just now. It says, I saw in your video that you said inflammation is good because the body is healing. Can you talk more about that?
Yeah, there's two different types of inflammation. Local inflammation is how the body regenerates tissue. And you know this. I mean, if you get scratched or on your skin, it's going to turn red. It's going to increase its metabolic response. So you're going to feel heat there. And that's how the body regenerates. The way we reverse arthritis of the spine or joints is we'll cause an inflammatory response at the level of the disc or at the level of the synovial membrane. And that initiates cells to regenerate. So inflammation, local inflammation, is how the body heals, and your body's healing all the time. Now, systemic
Wow.
inflammation is deadly, and this is what will kill you. And systemic inflammation means inflammation of the entire system. So, like
Oh.
when you start to damage tissue, your body can heal. And one of the examples I use is, I think, one of the coolest tortures ever was called the death of 1,000 cuts.
Oh, yeah.
And you can heal from one cut, you can heal from 10 cuts, you might be able to heal from 100 cuts, but eventually you're going to reach your threshold of where you can't heal and your body breaks down and dies.
Wow.
So when you look at you can eat a McDonald's French fry. You can eat, genetically modified bread. You can eat, all of these different things, but you can take an antibiotic for something that's inappropriate. You can eat a burger that is loaded with antibiotics. All of these are going to cause leaky gut, which means you're going to have foreign proteins going from the digestive tract into the bloodstream. Your body's going to recognize those foreign proteins as invaders and mount an inflammatory response to wall off those pathogens. And this is where people die. Then you're going to have a systemic inflammatory response to these proteins, foreign proteins that are getting in areas they shouldn't. And then what the body's going to do is it's going to raise cholesterol, because you need cholesterol in order to produce cortisol, which is a massive anti-inflammatory agent. And so then you get people who have taken in the toxic food. You're getting the foreign proteins in the blood. Your body responds by elevating cholesterol. Your body responds by producing cortisol. And in response to this, and then in stupid world, they're going to say, "Oh man, your cholesterol's high. We got to lower this. Oh,
So
you're under adrenal fatigue. We got."
So for
Yeah.
for someone like me who makes pictures up in her head to understand things, I'm sort of seeing this like, you're taking you've got this plate of food. It looks absolutely delicious, but it's all full of genetically modified or hormones, and even though it's beautiful and it smells good, I'm putting it in my body. My body then goes to war,
Yep,
and then I get
exactly.
sick. All right, well the next slide is because we want to play Stump the Doctor. You ready?
Sure.
Whoop, that was good. What is this?
That that's going to be, well,
I
you
heard it
could
was a
call it
type of arthritis.
you could call it psoriasis, you could call it eczema. But what's interesting, it can be a type of psoriatic arthritis. But when you look at the foot, let's start looking at this. Toxicities of the blood are going to first show up in the foot. This is why psoriasis, eczema, athlete's feet, diabetes, and gout show up in the feet.
So
Okay,
if
first.
you've got stuff in your feet, then something's off in your system.
There's something off in the system. So, but now let's keep looking at the feet. Look at the big toe. The big toe angles off at an extreme position when a normal toe is going to go straight up and down. Okay.
And by the way, these are not our feet, just so you guys know. These are not my feet. These are not Dr. Bergman's feet. We're good.
Yeah, yeah, I got purdy feet.
Me too. I have ready feet. Okay,
So
so continue,
with
please.
that with
I don't
that
want to be
deep
too long on it. It's sort of gross and we're at lunchtime, but I just wanted to show it. Keep going.
no, well, with that deviation of the big toe, you're seeing bunion formation. Bunions form only because of weak muscles inside of the foot.
Wow.
And muscles in the foot only get weak because of the nerves that supply the foot, which come out of the low back, aren't functioning correctly.
Oh,
So we're looking at plantar problems, flattening of the feet, bunion formation, indicating compressed nerves in the low back, which also means that there's probably going to be a pelvic issue. So even though this is presenting has a foot skin issue, and
yeah.
you could diagnose it as a lot of different things. It's probably diagnosed as psoriasis, but
Well,
it's
it
not.
said punctia type palaplantar keratotomia.
Yeah, yeah. When you look at this, and this goes along with 100 different diagnoses,
Yep.
it's going to be certain areas, the plantar just means plantar surface, or that's the bottom of the foot surface in Latin. But this is a systemic toxic inflammatory response, and the body's trying to get rid of the toxins. This is why chickenpox and measles develop these pustule lesions to get rid of the toxins.
So
So
this
this
would
is,
be a good picture to show of what this is what happens if you eat horrible stuff.
and also this is a picture of how the body responds to a toxic deficient environment to get rid of those toxins as fast as it can.
Wow. Okay, I gotta move the picture because it's yucky. Okay, so I love to make Dr. Bergman scream, so the next slide is to make him scream. So those of you that are new to us, he's very vocal about his beliefs, and he's really right, because our bodies were, we knew what to eat in the beginning. We ate what was normal for our bodies, and now we're putting all kinds of crap in it. So we just showed you a lot of problems with the body, and this is the first solution that everybody goes to. You guys ready for him to scream? Close your ears. There you go, Dr. Bergman. That's the solution that they give us.
Ah! Okay, okay.
This only causes more problems, right?
Well, I don't know. Let's look at the history of this. Okay, now this used to be called patent medicine, which in order to make a drug, it has to be foreign from the body, foreign from the planet, completely unique and patentable. Now, everything, it doesn't matter what the drugs are, and this could be a cholesterol drug, an antidepressant, an antacid. All drugs only do one of three things. They're going to block an enzyme or block a receptor site on a cell, poison an enzyme, or make a cell more permeable. They only do those three. That's why when you're listening to the commercials on TV, they say, oh yeah, try Humira for rheumatoid arthritis. Of course, side effects may be dizziness, nausea, vomiting, and you're going to hear a lot of the same side effects, because the drugs only do one of three things. They make a cell more permeable, block a receptor site on a cell, or poison an enzyme. So these things all here are going to change your metabolic response or your body's response, which in an acute condition can be fantastic.
Mm-hmm.
When I was run over by a car, I had both my legs broken. I'm laying in the hospital bed. I'm really not comfortable. My sternum's fractured. My skull's fractured. Hun, they gave me morphine. I couldn't have been happier. That went right up to my brain.
So that was a receptor blocker, right?
Oh God, was it ever?
Yeah.
I loved it. Enjoyed the hell out of it. And I got to tell you, in the same circumstance, I would be down in morphine for a temporary relief of the discomfort. The problem is this, what you're looking at is a lie, because this lie is perpetuated by medical doctors, by nurses, by the entire media, that you can have a hedonistic medical system where it doesn't matter what condition you're suffering from, it doesn't matter how you treat your body, that you can live life without discomfort. You can have a cold without having sinus problems. You can have a fever and an immune system response. We'll give you something to reduce your fever, relieve the aches and pain, eliminate the mucus out of your thing. If you eat stuff that's causing you to have an upset stomach, no problem. We can give you a little purple pill. We can give you this. It's absolutely insane and ignorant and arrogant that a doctor would give you a medication to alter your physiology that's going to have a host of other effects that's not appreciating how the body works. Those guys need to be fired. I'm not passionate about this. I'm just based in science.
Okay. I love it. I do, and I love showing you pills every time because it cracks me up. I realize that I spent most of my life, for those of you that are new to me, I was over 500 pounds, and part of the problem is I was diagnosed for something I didn't have, and I was on a medical regime that you wouldn't believe, handfuls of pills, morning, noon, and night, that ended up making my organs stop working. So we're going to move in now to the next phase. We've got a bunch of questions. I want to make sure we get them answered, so I'm going to keep us moving. First of all, we're going to go into Stump the Doctor, okay? This is true and false. You ready, Dr. Bergman?
Absolutely. Oh, and if I go off on a rant like that, you could interrupt me and stop me.
Oh no, that was perfect. I'm so with it, because I always felt like my solution was in a bottle of pills. That if I had a headache, if I had a backache, if I was sad, if I didn't want to get dressed that day, that my solution was that. So I'm with you, and we're helping people. Really quick, someone wrote they're going to make you a juice recipe that was on your YouTube channel. What brand of protein powder do you use?
I like Sun Warrior.
Okay, Sun Warrior. Stump the Doctor. True or false? Once you've got arthritis, because that's our topic, that's it. It's never going to be changeable, and you're going to always be miserable.
Wow. Makes me want to step in front of a bus. Yeah, no, that's completely false. Absolutely false. Impossible. Now, I had a patient. Well, he's still my patient. He's an orthopedic surgeon. Massive degeneration in his neck, causing his hands to go numb, and he didn't want to get neck surgery. And so I'm telling him, look, you've got arthritis in the neck. We need to regenerate the discs. We need to restore the curve. And he said, regenerate discs? And I said, Doc, are discs alive or dead? Okay, so now to answer this question, are your joints alive or dead? Okay,
Alive.
they have to be alive. So
Yep.
if they're alive, they got to take in nutrients, produce proteins, and eliminate waste products. If that's true, then you change the nutrients, you change the position, and you change the metabolic response, then you can regenerate the joints in any circumstance.
Yay. So this would be false. Next one. Your exercise, no matter your age, has to be extreme in order for you to get the most benefits.
Completely false. Absolutely false.
Would
What
this
you want
work?
to do, um, oh, no. Walking will be good, but movement. But what these guys should do, they got to get to a chiropractor, restore the nerve supply because neither one of them have healthy calf motion, and that means that their foot's running out of blood and their leg is running out of blood, and that means they're going to be a lot tired faster than they should.
Wow. Isn't that crazy? Oh my gosh, I love playing with you. All right. True or false, if you've got arthritis, pain, and inflammation, you should absolutely take a anti-inflammatory.
Completely false. Not only is that totally not based in science, but look at the effects of it. When you look at Motrin, Advil, Aleve, the non-steroidal anti-inflammatories, the mechanism of anti-inflammatory response in the body, what they do, what they actually friggin' do, it's called clinical pharmacology. They inhibit proteoglycan production. That's the building block of cartilage. So every
Wow.
time you take a pain reliever or non-steroidal anti-inflammatory, you're destroying the body's ability to produce cartilage. That means you're destroying the joints. So what the doctors should say, the ignorant doctors that pass this stuff out should be saying, hey, this is going to make you comfortable, but it's going to cause your body to rot.
So basically, the prescription I've got for 800 milligrams of ibuprofen that I'm supposed to take 3 times a day is a bad idea.
Really bad, devastating to your system. And it's oh my God, beautiful. You put up the alternatives. Okay,
We're,
you got vasodilators in the peppers there. You've got anti-inflammatories. You've got so many good things. But if you look at turmeric, if you look at vegetable
oh,
juicing, you look at water, all of those have anti-inflammatory effects that aren't going to negatively affect the joint. It's actually going to cause the joint to heal.
well, we're going to move into food in this next little piece, and we're going to ask some true and false questions of ones that I believe will help. But first, what kind? Someone asked me last week, and I didn't get to Dr. Bergman because we mentioned that he juices. He's got 5 juicers, and she's asked a couple times about juicers. What brand of juicer do you recommend? She was looking at the Omega VRT 350. I know I use the Breville, but which one do you recommend, Dr. Bergman, if any?
Oh, I've got like an obsession with juicer envy. I love the Omega 350. It's fantastic. I just got a new one by Kuving,
Oh,
Kuving.
oh,
That
oh,
that you it's got a larger feed tube and
oh,
it's
yeah.
got the same exact mechanism that the VRT 350 has. And now I'm in love with the Kuving. And
I
it's
still want to
it's like
come
the
over.
yeah, I think it's a Kuving 9,000 or
Oh my
8,000, something like that. It's so much fun. Oh my God, easy to clean and
God.
super good quality juice. The pulp is dry. Yeah, but I love my old champion too because that's what we make ice cream out of.
Okay, so now we're going to move into some of foods that I recommend highly for helping you get healthy and also they're trick questions. So we're going to ask Dr. Bergman true or false, and then I want you to know that at the end we're going to be telling you about a book that we made you for this class specifically with some of the information that Dr. Bergman's given us, as well as some recipes and some information about ingredients that you can put in your diet. Did you notice, guys? I want you to type in because I want you to make sure you're listening that as soon as he saw this picture, he immediately was excited and said, that's the solution right there. He went right away to the colors, the peppers, and all the different things. It's right there, our solutions. So let's go for the next one. Oop, my goodness. See, I'm clicking too many things. True or false? This helps with inflammation. Dr. Bergman, that is
Absolutely,
ginger.
absolutely true. This is phenomenal, but it's also, now this is kind of cool. It's a heat generating herb, and it
Hmm.
has antimicrobial effects. Remember, when you're talking about inflammation, inflammation is the way the body heals itself. So the difference between an anti-inflammatory effect of a food as opposed to Advil or Aleve. This one facilitates or allows the body to go through that inflammation process and regenerate the joint, the tissue, the disc, the cartilage, the synovial membrane, anything that's damaged. So food anti-inflammatories actually facilitate the healing, where a chemical anti-inflammatory destroys the healing.
So you're going to get a recipe for ginger tea, which is something that not only is great anti-inflammatory, but anti-nausea. All right, this next one surprised me when I was doing my research. Come on. Walnuts. True or false?
This is a tough one because they've got some good healthy oils. There's some really good things about it, but you got to stay away from the walnuts if you've got a low functioning thyroid or adrenal fatigue.
Okay.
So nuts used sparingly is okay, but you want to avoid it because they're so high in the polyunsaturated fats.
Okay, good to know. Let's. I've got a couple questions coming in. I want to make sure we get to that are longer answers. So we're gonna finish. We're gonna go with this. This one I love. True or false? This is a good one for helping with what's our theme? Arthritis and
Uh,
anti-inflammatory.
Absolutely true. This is fantastic. There's even a couple of, you can get this in pill form. It's called bromelain, and it's an enzyme that has phenomenal anti-inflammatory and pain-relieving aspects, but it just is delicious.
And I juice this a lot and then put fresh squeezed orange juice in it for both myself and my partner. Bromelain. Okay, so as you guys know, monkey time. Even monkeys know that pineapple is good for you. Okay. True or false? Sweet potatoes are good for arthritis.
Fantastically good for it. Yeah, and in fact, root vegetables have, since they're grown in a moist environment, they have anti-fungal, anti-mold properties already built into their environment. And the sweet potatoes are phenomenal. You saute a sweet potato up with a little bit of coconut oil and some turmeric and some sea salt and pepper. That's a phenomenal meal.
Oh yeah, I eat a lot of these so much so that I actually made a new puree that I love, and it's in the cookbook. It's a roasted sweet potato and a turnip puree that's just to die for because the turnip adds the spiciness. True or false? This is turmeric. This is good for you.
Oh, I love the true or false. This is one of the most studied herbs on the planet. There's, I think, 1,500 different studies that use or are studying turmeric, not just anti-inflammatory, but anti-cancer.
Hmm.
It's an adaptogenic herb that or substance that functions different in each person, but its healing properties are out of this world. We juice turmeric.
Oh yeah.
I mean, you cook it, slice it. It's amazing.
So you'll get a recipe for turmeric rice, which is an easy way to start if you haven't tried turmeric before to start getting it in your diet. And do juice it. I love it because when I peel it, my fingers turn yellow. So we made a book for you. It's called Foods That Heal Arthritis. It's got a bunch of recipes in it and a bunch of information. But I want to get to some of these questions, and then I've got a few more slides with you guys. This question, my boyfriend fell off a roof and landed face down on his face and chest. He has pain in the sternum area every time he coughs or sneezes. The doctor did x-rays and nothing appears to be wrong with the sternum. Could there be soft tissue damage or anything to do? Can he do anything? Because every time he sneezes, he says, ouch.
Yeah. First thing he needs to do is fire the doctor.
Fire the
Okay.
doctor.
Yeah, because obviously this doc doesn't have a clue. The nerves that come out of the spine. So with that type of impact, he's going to have a neck issue. He's going to have a mid-thoracic issue. He's probably going to have a pelvic issue as well, and he needs to go to a corrective chiropractor. The X-rays were probably done by either a chiropractor that doesn't understand. That the body can regenerate, so they're not looking for subluxations, or it's done by a medical doctor who doesn't know that misalignments can negatively affect the body. But if you have a pinched nerve, his in between his shoulder blades is not going to be comfortable either, and his shoulders are going to be tight all the time, more than likely. On his x-ray, he's going to be missing a curve in his neck. He's going to have forward head carriage, and he's going to have some type of lateral deviation of the thoracic or chest area that's leading to this. And the ribs itself, the thoracic area, you've got cartilage that connects the sternum to the ribs, and then from there it's bone that comes around. So he's going to have costochondritis, which means the cartilage and bone connection is going to be injured. I work on a ton of martial art patients, and this is super, super common. In order to correct this, you've got to fix the neck, fix the rib cage area or the thoracic spine first, then you can work on the rib cage. Yeah.
Wow. I think I'd rather be damaged doing martial arts than falling off a roof. Okay, here's a comment. My sister-in-law says that if she can't heal any issues with her juicer and lifestyle changes, then she deserves to feel the pain until she changes.
No, no, no.
I'm sorry to laugh. Oh my goodness.
Pain sucks, but it doesn't purify the soul. No, that I mean, there's so many natural alternatives. There's so or natural solutions, not alternatives. That the drug shouldn't even be in our psyche. It shouldn't be in our stores. It shouldn't even be prescribed. If you have pain, there's a tremendous amount of vasodilating herbs. I mean, try cayenne pepper. Try water and the cayenne pepper pills. I mean, it's those things open up and they instantly cause, if the pain is from lack of blood flow, direct application of heat or direct application of ice. There's so many things you can do to be comfortable and feel good while your body's healing. Pain sucks.
Well, it's so crazy because, like I said, I always thought solutions were in the bottles until I had to go through this, and I'm learning so much, and it's like I still continue to learn, but I was suffering these horrible headaches, and all of a sudden, I took certain things out of my diet, and I changed the way I did, and I started hydrating more. I mean, your partner has told me so many times, Michelle, you must be dehydrated. Drink more water, and I started. It made a difference. Something that simple. Here's another question. In your opinion, do you feel that it's much healthier to eat organic fruits, vegetables, and berries? Do you feel it's much better to eat grass-fed meats? If we aren't eating organic, are we harming our digestion and our gut? You've sort of answered that, but go ahead again.
Yeah, there's a couple of foods that absolutely, without a doubt, have to be bought organic. Okay, and there's some foods that you don't really have to. Okay, buy organic because there's not a lot of pesticides in the growth or the production of these plants. And you can look at it on the internet, but it's like coconuts. They don't use a lot of pesticides when you're growing a coconut. Strawberries, they use a tremendous amount of pesticides when you're using strawberries.
Wow.
So fresh, organic, and they're called the Dirty Dozen. Okay, you can look at it up on Google. The plants that absolutely have to be bought organic, and then the ones that, if you're living in the real world like most of us, you might not have the opportunity to find it organic.
Well, I know apples and potatoes, right?
Yeah, apples got to be organic. Potatoes got to be organic. Okay. And when you look at it, go to the farmer's market and ask the farmers. Say, hey, is this grown with pesticides or without pesticides? And they'll be straight up with you. That it doesn't need to be organic, but as long as it's grown without pesticides, it's consumable. But the pesticides that they're using now actually destroy the intestinal tract of the insects, the glyphosates or Roundup Ready. So if you're eating something that isn't organic, that has pesticides on it, it's going to cause holes in your gut. That's going to cause proteins to get in the bloodstream. That's going to cause systemic inflammatory problems. So it's not food. It's not even an option.
So if bugs are dying, don't eat it, and then you'll turn into a mutant. Oh my goodness, this is so crazy. God, it's just so crazy what we do and eat. But what's interesting is I've had a lot of questions from you guys. Well, I don't live near a farmer's market. How do I get organic? I can't do that. I live in the middle of nowhere. And I'm going to use Lila as an example because I know she's one of my kitchen table members, and she lives in Douglasville, Georgia. And we found out that there was a couple organic stores near her and a bunch of farmers markets that we didn't realize. But the cool thing is she found out, just like I do here, is that she can order a box of organic vegetables and fruits to be delivered to her house every week. And she gets to pick and choose what goes in it. And she's trying new things. So here she is in the middle of nowhere. Her address is on a highway. And she's finding new organic stuff and meats and grass-fed meats and stuff. So it's totally possible to do it, to incorporate those things into your diet without breaking your budget. budget, because it's usually around $30 or $25 to get a small box cross country, anywhere in the country with your local farmers. And I think it's a pretty great way to do it, don't you, Dr. Bergman?
Oh yeah, and they can get it frozen too. I mean, at Costco, this is in America. We got these big food or warehouse stores.
Yep.
They're frozen vegetables, frozen fruits, frozen. In my refrigerator now, I've got frozen broccoli spears. I've got frozen acai berries,
Yeah.
and it stays fresh forever.
Yeah, I've
And
got
and
frozen pineapple and peaches, but all organic, and strawberries. So I'm going to.
what's interesting in some fruits, if you freeze it, the antioxidants actually increase.
Oh my goodness, I didn't know that. Really?
Yeah, it's pretty cool.
Wow. So this is Dr. Bergman. Next time you see him, it might be Tanner. I really appreciated him coming. I'm going to give you the link to the book that we wrote for you guys, and it's just for you guys. We've put recipes in there. We've put some of the information that Dr. Bergman's been talking about the turmeric and all the good nutrients that are in these fruits and vegetables. I want to tell you what's going on also, just so you know, if you don't mind, Dr. Bergman, let people know. We have a brand new page. I'm so excited. It's called Gluten Dairy Sugar Free /events, and it tells you what's going on. The next class is how to dine out and how to be gluten dairy sugar free with ease. We have a kitchen table class next week, which is about substitutions and conversions, teaching you how to change your recipes so they're healthy. And then we're going to be on the cruise for a week, and that's on our schedule too. I'm really excited about that, Dr. Bergman. We're going to be, I think he said he's teaching, 15 hours?
Yeah, well, you're going to be teaching 2 hours. I'm going to be teaching like 12, and then we've got a couple of other speakers. It's going to be exciting.
It's going to be a lot of fun, and I know that this is the first one, and there might be others, so you guys start listening about that. It's a neat way to be able to spend time and ask all those questions that you have. It's not hard to get healthy if you start thinking clearly, and the way Dr. Bergman talks about it, it's so clear. It's like if the bug is dying, don't eat it. If you put it in your system, I'm using my lay language, you're going to turn into a mutant, and your body's going to be weird. I have another thing coming up. Let's see. Oh, I love that man. I wish he could address the nation like our presidents do. Oh, that is so great. I totally agree too, because Dr. Bergman, he talks about what's real, and that's why I partner up. Because some of you know me. I don't partner up very easily with people, but they have to walk their talk, and Dr. Bergman does. I mean, he is teaching you exactly what's going on. So I just want to tell you guys. Here's a picture of spices. Start looking at spices and seasonings different. They really can help your life. Okay, they're writing Dr. Bergman for president now. Okay, you guys are lunatics out there. But I want you to try new things. Every week, I ask our listeners to try new things. Post on our fan page what you've tried, what's new. I'm going to show you a cute picture. This is a picture of my sister, Chanel. She was on an island in Mexico about a month ago, and a raccoon came up and didn't like the veggie she offered the raccoon, but took the tortilla chip. Anyway, the point of the picture is try something new. Get something new in your diet. Try a new vegetable. Try something organic. Start looking at that. And Dr. Berkman's right. It doesn't have to all be organic right away. I'm not asking you to take your paycheck and just throw it away to those fancy stores, but start looking at some of the things. And what did you call them? The dirty dozen?
Yeah, there's and that's just like a catch-all phrase, but go on Google. There's certain things that have to be bought. There's other things that don't have to be bought. Organic, and really you're going to find farmers markets everywhere, and it doesn't take much to start a little home garden too, even if it's just for herbs. I mean, there's so many things you can do, and then when you do go to a farmer's market, so you can have fresh fruit and vegetables throughout the winter. Look at our video on fermenting foods. I've got some phenomenal fermented cabbage with some jalapenos at home that I'm going to have for lunch.
Oh my gosh, that sounds really good. And chilies are so good for you. So I keep all these recordings just so you know, if you want to go back and listen to them. We put them in the kitchen table membership area. I'll tell you a little bit about that. It's on your page where the book is. But basically, you can see the picture of the garden and how they're different beds. And what our membership is it's the map to all these different beds. So you can all the replays and all the books. We make an average of 2 to 3 books a week, Dr. Bergman. Now.
Wow,
The
cool.
The first one we did was the first call with you. We thought, well, we really wanted to make sure that your people got, because you were bringing your audience to us, and we wanted to make sure we gave them a gift, and they loved it. So now with every single class I teach, we make a book full of information. It's different every time and different recipes. So this time the book is about arthritis. It's got Dr. Bergman's information too. He also has a PDF that you can print out to take to your chiropractor to make sure you're seeing the right kind of chiropractor and not, as I would say, stupid people, right, Dr. Bergman?
Well, some people are for symptom relief and they practice allopathically. They'll say, "What's wrong? Let me fix what's wrong." And you go to a corrective guide, they're going to find out what's wrong. Let's find out why your body's responding that way.
Okay, here's the link again to the book, and we also on the website have a page about Dr. Bergman, where he is and what he does. We're also revamping that. I really appreciate you taking the time in the middle of a busy Friday to help us. Guys, type in, what's one thing that you'll take away today that you learned that you thought was pretty cool? Personally, from mine, I still am thinking, oh my gosh, every time I eat bad shit, I turn into, sorry, I said bad word. Bad stuff, I turned into a mutant. So what have you guys taken away? Oh, good. Try new veggies. Turmeric, someone said they'll try turmeric. Nice. What else, guys? Keep typing. I want to know. They're definitely going to buy a juicer. Now they want to look at your juicer. Turmeric, someone wrote. Okay, good. Sweet potatoes have fungal properties. Good. You guys are listening. I love our audiences. They listen so well. And we've been quizzing them too. All right. Well, on that note, I apologize again for the beginning of the class having technical issues. I don't know why I do it with Dr. Bergman. I think I get too excited and start just being really, because I love playing with him. Any parting wisdom? I just do. I get really excited. It's like playing in a sandbox with your best friend and you just want to share all your toys. So any parting wisdom words? It's going to be, he comes the second and third Friday of the month for us, but this time not, we're going to miss a week because we're going to be gone. But any parting words?
I got it. Thank you so much. I mean, this information isn't just life-changing. This is the new health renaissance. People are waking up to their body is intelligent and designed to heal. Disease doesn't exist. It's the body adapting to toxic and deficient circumstances. And by God, we're going to kick butt on the boat in a week, baby. We're going to be there. Yeah!
Yay, I'm so excited. I can't wait to play with you. All right, have a great day. Thank you guys for taking your time out to show up. You can find us on Facebook and ask questions. We're happy to answer. Have a great day. Bye.
Bye. Thank you.
Thank you.